Good morning, everyone, and welcome to the Ohio Means Jobs Columbus Franklin County Job Center's Employer Highlight Series. My name is Scott Johnson. I'm the Job Center operator, and I'm excited to announce that today I have Matt Smith, who is a senior recruiter with PrimaryOne Health, here with us to talk about the inside look at PrimaryOne Health. Matt, welcome to the Employer Highlight.
Yeah, thank you for having me. Really excited to share a little bit about our organization and talk to you about some great opportunities we have available.
Excellent, excellent. I think that's probably the best place to really start the conversation. I know a lot of individuals in our community have probably heard of PrimaryOne Health from, one aspect of as a healthcare provider, as a nonprofit advocate within the community. But would you care to share a little bit about the organization, its history, and everything with our viewers?
Absolutely, thank you. So PrimaryOne Health actually is the second largest federally qualified healthcare center system in the state of Ohio, and actually the largest here in Columbus. We've been around for just over 20 years. We were originally actually the Columbus Neighborhood Health Centers, but I believe back in 2012 or so had moved over and assumed the PrimaryOne Health name. We are, being federally qualified health centers, are extremely involved in the community. Basically, being an FQHC means that we get our funding from the federal, state, and local governments, and then we do a lot of grant work with other organizations as well. And so there's organizations that would like to partner with us in order to launch healthcare initiatives within the community. So we have 11 different primary care clinics here in the Columbus area, and actually one in Circleville as well. We also have, very excited to share, that we have 4 brand new mobile health centers that are basically clinics on wheels: 2 examination rooms, a waiting area, a restroom. Really the idea behind that, Scott, is that we have a really strong presence within the community. And we really are looking to get out in the community, and a lot of our patients that might have transportation issues that can't come see us, we want to make sure that we can come see them. And so to be visible in the community at community functions and events, being in a neighborhood on a certain day, allows us the opportunity to reach individuals that might have difficulty coming to see us. So we're just really excited about these brand new mobile health centers. So really, as I was saying, we've been around for over 20 years, and we continue to grow. Very exciting things going on with our organization right now. But really, being a federally qualified healthcare center system basically means that we're not turning anybody away based on their ability to pay. We want to make sure that we can serve everybody in our community and really give excellent healthcare services to all individuals. And we're very proud about being able to do that.
Excellent. And I know PrimaryOne Health has been a great partner with us here in the Job Center over the years, and really helping us connect our job seekers and our visitors with a lot of great resources. So,
absolutely.
As I listen to what you're talking about, that accessibility is a key thing that we all hear about. And so the way that you guys are doing that is great. But I think more importantly, the takeaway that I just had from that overview of your structure is that this isn't just an opportunity to engage and work for a healthcare provider, but it's a way to make a huge impact on the community. So if there is a job seeker out there who's thinking, I'd like to work, I already work in healthcare, I'd like to make that transition over, it sounds like PrimaryOne Health would be a great opportunity to do that while really making an impact on the community. Can you talk a little about the culture of PrimaryOne Health? Because, for me, I think anytime that I consider making a change or applying for a company, one of the things I really want to know is, what is the culture like within the organization?
Absolutely. And extremely important workplace environment. What's an organization like really from the inside is extremely important. And I've worked for a lot of different organizations throughout the years, and I'm really excited about the place that I'm at right now, and hopefully continue and end my career here. So, and I'm honored to be here, quite frankly. As a healthcare organization, like other healthcare organizations as well, patient first. is extremely important. We are very, very value and mission-driven organization. As I had mentioned, strong ties to the community. We want to, again, make sure that we are offering the best healthcare that we can for really individuals in our community that might have barriers to healthcare. And when I talk about barriers, things such as transportation, just being able to get to and from your appointments. We actually have a relationship with Lyft, the rideshare organization. So we can actually get our patients to and from their appointments if they need assistance at no cost to them. Other barriers, of course, might be language barriers. We have on-site interpreters, of course, bilingual associates, but also utilize the MARDI system, which basically is an iPad on wheels is the best way to describe it. And it allows us to have 120 different languages that we can press a button and we'll get a live individual on this screen that can interpret for us. So it's really exciting, but also financial barriers that I had alluded to earlier. We work off of the sliding fee scale at all of our clinics and all of our mobile health centers as well. So based on your income, individuals within your household really will determine what your costs will be. And we have resources that we can assist with those additional medical costs that certainly are burdens for all of us. So case in point, when I think about our culture and I look at hiring individuals, the best way to put this is just a really nice place to work because they're just friendly people. I think we all are here for the same reasons. As I mentioned, very value mission-driven organization. I have the pleasure to interview individuals all the time. In fact, I interviewed 2 individuals yesterday that are patients of ours that really felt compelled to come to work with us because they want to be able to give back. And so as I am looking at individuals to hire, a lot of individuals that want to come to work with us really want to be able to make a difference within the community. And so as a culture, it's a very caring organization, very welcoming. And for that, when I started, the best way to describe that is it's just very refreshing. It's refreshing because people here are honestly living and breathing the mission and the values. And so open door policy, extremely welcoming, extremely supportive. We're actually here to make sure that everybody has the tools to be successful. And so we have programs that we can help individuals grow within their careers as well. So really can't say enough about the culture. Best way to put it, it's a friendly place to work. It doesn't feel like a job to me, so I'm always excited to be here. So
yeah, excellent. I know, the things that I heard you mention that I think are really important to a lot of potential candidates. You mentioned a lot about diversity, equity, and inclusion. That support so that you as an employee can serve anyone who walks through the door. So that's excellent. And that is exactly how you guys operate. I think the other thing that's always really good to talk about as you connect culture with all the opportunities that you have is also, the benefits that PrimaryOne Health offers, as well as professional development opportunities. Can you talk a little about that?
yeah, absolutely. And I would like to add a little bit, one more thing, if that's okay, about our culture and just about an organization as a whole and how we support our employees. Clearly, in the healthcare sector and obviously all different areas of employment, COVID caused a lot of challenges. Clearly, we were fortunate enough to not have to furlough any employee during that time, and we're very proud of that fact. And so putting our employees first, of course, our patients and our employees first, was very important, and making sure that we could continue to keep talented individuals within the organization. So that was very important with us. So just tells a little bit more about our story and a little bit more about our culture as well. So, and then that I could certainly segue right into our benefits. We have an outstanding benefit package. Very excited to share that. like most organizations, medical, dental, and vision. But we have short-term, long-term disability, of course, retirement as well. One of the things that we encourage here within our organization are individuals that want to continue their education. Clearly we hire a lot of individuals that have just started in the medical field or the IT field or other business-related areas as well that may come in at more of an entry-level position or mid-level, but want to continue their education. So we have tuition reimbursement that we're able to offer all of our employees in order to grow personally, professionally as well. And so a lot of our employees will take advantage of that, of course, so they can move up from a medical assistant to an LPN, to a nurse, to a nurse practitioner, and the like, just to give you an example. We also have continuing education money. We want to make sure that every employee has available funds if they need to get recertified, if there's a conference in town that they want to attend. There are funds that our employees are able to use again, for that professional development and growth. In addition to that, actually, we offer 5 additional days a year, so 40 hours a week on top of your PTO in order to use that continuing education time as well. So really excited about our benefits. And another thing that I find really nice for our employees is, I'll give you an example. We're starting a group of employees on October 18th, and their benefits will start November 1st. So there's not a 30, 60, 90-day waiting period. So that's really nice. I've certainly myself been in between jobs and understand the importance of a good insurance, which we offer, but not having to wait that additional time in order to get that is very important. So great, excellent benefit package.
No, absolutely. It sounds like you guys are very employee focused and employee centered, which is extremely important. For those of you just joining us, we're here in our Employer Highlight Series talking to Matt Smith from PrimaryOne Health. Feel free to throw any questions you might have for Matt about open positions at PrimaryOne Health in the chat, and we'll be able to grab those as we move through this conversation. So, Matt, you've really set up the culture of PrimaryOne Health, the history of it, its importance to our community, and the way that PrimaryOne Health not only supports the community, but its employees, which is excellent. So let's talk a little about the actual hiring process now, because you referenced COVID. We all know that a lot of HR practices changed, a lot of interviewing practices, those type of things changed. So for anybody who applies for a position with PrimaryOne Health, what does that hiring process look like for them?
No, absolutely. And like all organizations, we had to kind of adjust on the fly and be flexible during COVID. And certainly everything was virtual, like you and I are doing at the moment. And it worked well, but there's certainly challenges to that. And so we're excited to have the opportunity to meet with our applicants in person. But basically, the onboarding process would be, of course, I would encourage everyone to visit our website and our careers page if you do have an interest in exploring opportunities with PrimaryOne Health. I would also say that keep in mind that though we are a healthcare organization, of course, we're not all nurses here. We're LPNs or medical assistants or physicians. We have a lot of different opportunities available, running the scope of, IT, data analysts, billing specialists, it takes a team for sure to run a good sized organization. So the first step of our process would of course identify a position that you are interested in on our website, and I would encourage you to, of course, apply. Now, as individuals are applying to particular positions, I am actually taking the opportunity to review applications. And upon that, based on qualifications, obviously meeting the minimum qualifications on skills, I will reach out to each individual and actually do a fairly brief phone screen or phone interview, have you, to really get to good understanding of an individual's experience and skills. But I will also say, as important is, as I'm hiring individuals for this organization, wanting to make sure that this individual is a fit for us, but I want to make sure that we're a fit for them as well. I encourage individuals to interview me as I am speaking to them as well, to make sure that it's a good fit, because the last thing we want to do is have a mismatch when we're bringing on board an individual. We want to make sure that it's a win-win for both of us. And so initial phone screen conversation, discussing skills, discussing really also what's your motivator, where's your passion, why are you interested in healthcare, or why are you interested in PrimaryOne Health? Those are things that are very important to us as well. After a phone screen, if the individual and if we both agree, I should say, that this is something we'd like to move forward to the next process, that would be a formal interview. That would either be here at our corporate office, but it could be at one of our 11 healthcare centers as well. And so it'd be, again, meeting with myself and either a supervisor, a manager, or a director, or some of our leadership team, depending on the role, of course. So phone screen, again, if you're in town, of course, then it would be an on-site interview. Depending on the role, certainly some of our, a physician interview might be a little bit different than our patient support specialist interviews. So some are a little bit longer than others, but really the phone screen, on-site interviews, and then at that point, basically would be determining if we are interested in extending an offer. I would like to think that it's a pretty nice, streamlined process. Absolutely. I've been on the other side where I've actually been applying, and I know that it can be a little bit frustrating. I make it a point to make sure this is a very candidate-friendly experience. That's really important. I've applied places and had my resume sit in that dark hole, as we talk about, unfortunately, and those things do happen. But we do a really good job here of making sure that it's a nice, streamlined process. I'd like to think that I have a sense of urgency in moving things forward in a timely manner and following up. I want to make sure that everybody has a good understanding of where they're at in the process as well. So that being said, we move fairly quickly, which I believe is important, especially in this market as well. There's a lot of opportunities out there, and there's a lot of skilled employees out there looking for work as well. So we want to make sure that we are, as we are identifying talent, that we are moving quickly to get out an offer and get those individuals part of this organization.
Yeah, that's excellent. And, the one thing that I heard you reference again, and it just goes to this common theme that we're hearing, is about being very employee focused.
Yes.
For that. What about direct screens and background checks? Are those part of the actual onboarding and hiring process as well?
Yes. Thanks for asking. So after an offer has been extended and an offer has been accepted, then we have an excellent team here within our HR that handles the onboarding process. And so with all of our onboarding, we want to make sure that we do a background check, which does include a drug test. We want to make sure if depending on the role, if you have a certification that is required, we want to make sure that that's active and, of course, in good standing as well. And so we will check your educational background also. There are some, being a healthcare system, there are some additional tests that need to take place as well. So we do ask that everyone does see a doctor and do a physical as well. Make sure that we're up on our TB shots. I would like to say that most like other healthcare systems right now, we are requiring the vaccination. And I think that a lot of organizations are moving towards that right now, so I did want to share that. But we will do the typical drug test, background check, pardon me. That does include just making sure certain certifications and education is correct as well.
Yep, excellent, excellent. So before we talk about some of your open positions, I think that the thing that I'm extremely excited about, and this is where we as the Job Center appreciate our partnership with PrimaryOne Health, is all of the things that we're doing together over the next 2 weeks. We're obviously in this employer highlight series right now. We're getting a chance to really talk about your organization and how awesome it is. But then we're going to have you on site this coming Thursday for what we call Thursday with an Employer. And so interested individuals who have a desire to work with PrimaryOne Health, they can actually register by calling us at 614-559-5052 and scheduling time to attend this 2 o'clock session this Thursday on the 7th. And the great thing about it is that Matt will go over some of the things that we just talked about as far as the culture and the nature of the work at PrimaryOne Health and the open positions. But then we'll roll right into an application session so you can actually start that whole process. So it's a great way to really connect with Matt and the recruiting team at PrimaryOne Health and move forward. And then the other thing that's super exciting is that we do have one of our core virtual hiring events, which starts the following Thursday. Actually, it's the 4th Thursday of the month, so we'll get you guys connected there so that we can actually, have everybody connected that way. And it's the 28th to the 30th. Boy, I just wished Halloween was getting here a whole lot sooner than it is, didn't I? I think as we start to wrap up the conversation, Matt, probably the best thing you could do is talk about and give a brief description of a few of the key positions that you guys are really recruiting for right now at PrimaryOne Health.
Absolutely. Thank you. As I had mentioned, being a healthcare organization, again, we have multiple opportunities that really run the gamut as far as different areas of employment. So please, if you don't feel that you have healthcare experience, I would still encourage you to look on our website because we have multiple opportunities that might be of interest and you might be qualified for. Please take a look at our website. But right now, a lot of our focus at the moment is really looking for individuals that have some strengths within customer service is extremely important. And obviously, our customers are our patients, for lack of a better way to put it, I should say. And so 2 roles that I'd really like to kind of focus on right now and talk to you about are our patient support specialist position and our patient navigation specialist position. Both are very, very critical roles within the organization. Our patient support specialist associates here at PrimaryOne Health are really those individuals that are your first point of contact at all of our healthcare centers. Some might be referred to as front desk personnel. But anytime you've been to a clinic, those are those nice people behind the desk there that make sure they greet you and make sure that they are taking all the information that we need to make sure that we have that correct in our system, whether that's collecting insurance. But if you're not insured as well, we welcome you to PrimaryOne Health. But patient support specialist is one of the roles that we definitely have multiple opportunities at quite a few of our clinics right now. So really those individuals not only are checking in individuals, scheduling appointments, scheduling follow-ups, those types of things that you would figure that those individuals in those roles would do. But here at PrimaryOne Health, we offer quite a few additional resources that we can offer our patients. And so some of the things that our patient support specialists are doing as well when they're checking in our patients are seeing if an individual might qualify to get a card to go to the Mid-Ohio Food Bank once a week for fresh produce. A lot of our patients might qualify for that. And our front desk patient personnel individuals are working with our patients to get them signed up for that service. In addition to that, we can also, our front desk personnel, patient support specialists, We'll also work with our patients to see if they might qualify for a 340B prescription plan. And basically what that is, based on your income, you might qualify to get a 90-day prescription for $12. And so we can get our patients signed up for these additional services as they come into our clinics. Just to give you an example, in 2019, we saved our patients $16.9 million in prescription costs alone. And all of that started actually at the front desk with our patient support specialists.
That is awesome.
So, it's amazing. And you can imagine the burden that we are lifting off of our patients to not have to worry about their prescriptions. Very important. So that's an extremely important position within our organization. And as I am looking at individuals, you don't have to have healthcare experience, really looking for customer service, an individual that understands that our patients are the most important thing. Those individuals in our community that really need our support and need our assistance, and making sure that they have an outstanding experience when they come into our healthcare centers, get the services and the support that they need, and are interested in coming back. And so I would absolutely, if that sounds like you, please apply, because we have needs and opportunities and growth opportunities as well. Another opportunity, as I mentioned, is our patient support specialist role. Similar to our patient navigation specialist role. Similar to our patient support specialist role, but our patient navigation specialists are actually here at our corporate office, and they're handling phone calls from our patients. Individuals that might be calling in about billing questions, about scheduling questions, about their test results, which we actually have LPNs on staff that can handle those questions. But these are individuals that are handling our patient calls, making sure that our patients get the support that they need in navigating, hence the navigation specialist, navigating our healthcare system. So another excellent opportunity, a little bit more behind the scenes, not having that face-to-face interaction with our patients, but absolutely, if you're looking to help individuals, and that's important to you, you're definitely going to be able to scratch that itch in both of these roles and within our entire organization. So again, both of these opportunities are online, as well as numerous other positions. And I certainly encourage you to take a look at our website and reach out if you have questions.
Yeah, excellent. And, you know, you're right. It's always great to be able to come to work and to be able to make a difference and really interact with others in
Absolutely.
a really positive way. And I love the fact that you have both a face-to-face and more of a phone opportunity for individuals to engage with. So that's absolutely great. As a reminder, you know, Matt Smith is here from PrimaryOne Health as a senior recruiter, talking about all their open positions. We have the URL for their website and how you can explore all of their open positions at the bottom of the screen right now. Also, as a reminder, be sure to schedule to come into our Thursday with an employer, which is this Thursday at 2 p.m. Matt will be here with his recruiting team so that you can ask more questions about PrimaryOne Health and then move right into an application session with them. If you want to engage in that, just call us at 614-559-5052, or you can stop in the Job Center. We're located 1111 East Broad Street, just east of downtown Columbus. Matt, I want to say thank you. Not only for spending this time with us today, but really highlighting and lifting up the work that you guys do at PrimaryOne Health. You know, I can't imagine where our community would be without the work that you guys do every day. And it's really inspirational.
I really appreciate it. And thank you very much. And again, you know, we're all about the community and all about the patients and making sure everybody has access to healthcare that they deserve. And if you'd like to be a part of that, please take a look at our website. I'd love to have a chance to speak with you.
Awesome. All right, everyone. Thank you so much for joining us for our Employer Highlight Series today. We will see you in a couple of weeks, and we actually hope to see you this Thursday when Matt and the team are on site. Have a great